Hey everyone, welcome to the front row with Ed and Elizabeth. So as a physical therapist, a common complaint that I hear from clients is of chronic lower back tightness. And they'll tell me that no matter what they do, they constantly have this level of lower back tightness. They'll get massage, chiropractic, physical therapy, acupuncture. It'll feel great for about a day, and then afterwards it comes right back. And they're stuck. They try to stretch and it feels good in the moment, but it comes back the next day. They try to strengthen it and all it does is make it tighter. So if this sounds like you, stay tuned because I have an idea of something that you might be able to do. So if you're suffering from chronic lower back tightness, no matter what you do, to simplify things, it's almost like the muscle has forgotten what it feels like to be relaxed. It's almost like you have muscle amnesia. And what can cause this muscle amnesia? Trauma, age, stress, all sorts of things can make it to a point where that muscle almost forgets what it feels like because we have this new abnormal normal. Let's say after an injury or we've guarded or something like that, the muscle has forgotten basically what it feels like to stay contracted and what it feels like to relax. So the solution to this is to re-educate the muscle. So I'm going to show you a sequence of exercises that are going to try to help basically kind of reset the muscle spindles in the lower back so you get an idea of basically what it feels like to have that muscle be tight and what it feels like for that muscle to be relaxed. What I recommend is watching the exercises all the way through first and then playing the video back again while you're doing the exercises and so I can walk you through it. One thing about muscle re-education exercises, they are somewhat different than strengthening exercises. When you're done, you're not going to feel like you have this great workout, but yet they're not stretching or they're not limbering exercises either. Basically what we're doing is slow, controlled, pain-free contractions followed by relaxation of the muscle. And what we're trying to do is basically reset those little stretch receptors within the muscle and reconnect that muscle back to the brain again. So they're going to be really simple exercises, but the idea is that we're retraining the muscle. Common example I give in the clinic is if you hurt your shoulder, what's really common is for this upper trap muscle to help kind of guard and protect that shoulder. Well, initially that's a good idea, but after a while we want that upper trap muscle to relax. And oftentimes clients will come into me and they'll have no idea that their upper trap muscle is so tight. So we have to almost re-educate that muscle, if you will, to say, okay, look, you don't have to be tight anymore. Let's teach you how to be relaxed in that relaxed state again. You'll start the exercise sequence by laying flat on your back. You're going to bend up both legs and we're slowly going to do a pelvic rocking technique. And we're going to coordinate our breathing. As you inhale, your back arches up. You exhale, and it flattens the lower back. Should be pain-free, a nice, easy rocking. Repeat this 15 to 20 times in a pain-free range of motion. After you finish that, you'll slowly roll over onto your stomach. You may need a pillow underneath your hips if this position is uncomfortable. What you'll do first is turn your head to the left so your right cheek is on your left hand. You'll completely relax your legs, slowly lift up over your left shoulder, pause, and then back down. Look over your left shoulder and back down, making sure that you consciously relax after each repetition. We'll do 3. Then what we'll do is relax the head and we'll actually just lift the elbow up, back down, and remember to relax in between each repetition. We'll do 3 of those. Then we'll combine. Keep your cheek attached onto your hand, lift up your entire arm and rotate over as far as you can comfortably. We'll do 3 of those and then relax. You'll do 3 again, and this time you're going to lift your opposite leg, remembering to relax in between each repetition. Excellent. Now what we'll do is we'll do the same thing on the other side. Left cheek on your right hand. We'll reverse the process. First start just with your head, looking up over your right shoulder, feeling the contraction,
and then letting it consciously relax. 3 of those. Keeping your head relaxed, you're going to lift just your elbow as far as you can comfortably in a pain-free range. 3 of those. Then you'll lift your hand and your head up and back down. Up, back down, let it relax. We'll do 3 of those. Now we're going to incorporate the opposite leg. So lift up and then relax. Up and then relax. We'll do 3 of those. Excellent. Then you're going to place both hands in front of you and your forehead down on your hands. Slowly lift your head up as you lift up one leg and back down again. You'll do 3 of these on each leg, feeling the entirety of your lower back and your upper back muscles contract, and then consciously relax. Remember, this is all done in a pain-free range of motion, feeling each contraction and then feeling each subsequent relaxation. Then you're going to roll over onto your back. And we're going to do a few more of those pelvic tilts. Arms can go by your side wherever they're comfortable. And what you should notice as you do probably another 10 to 15 of those pelvic tilts, a greater excursion, a greater range of motion with the pelvic tilts as the lower back muscles have loosened up. Remember, 10 to 15 of those. Straighten out your legs, get an idea of how your back feels. You should feel more of your lower back against the floor now as those muscles have relaxed. Then what you'll do is you'll bend up both legs, curl your knees to your chest, pause, and let it relax. Knees to chest, pause, let it relax. We'll do those 3 times. Then once again, straighten out your legs and completely relax.
The whole exercise routine shouldn't take more than about 10 minutes, and I recommend doing it at least once a day, if not twice a day. It should take about a week and a half before you start to notice at the high end some of the tightness, that chronic tightness in the lower back starting to settle down. And then what you can do is you can settle into a routine of maybe doing it twice a week once you feel like the back has settled down to a point where you want it to. These exercises don't take the place of strengthening and cardio and stretching. This just has its own place. And remember, only if you're having that chronic level of tightness are these exercises the most effective. All right, give it a shot, see how you do. If you have any questions, please leave them down below. If you haven't subscribed to the channel, make sure you do so there. And I'll also put a link in the bottom here to a book where I got a lot of these exercises from. It's called Somatics by Thomas Hanna. And I highly recommend it if you want to know more about muscle re-education. All right, good luck. Let me know how you do.